It's an easy process for some people. For some children with some types of diseases, they end up going to an adult doctor who's used to taking care of their problems, say diabetes or seizure disorder or something like that. In some cases it's more difficult because they aren't as used to a childhood disease like cystic fibrosis or so on, and we're doing pretty well with those type of conditions. Other kids it's more difficult with more developmental delay, developmental problems, various neurologic diseases and genetic conditions, and so that's the soft spot in my heart now is to take care of the children as they become adults, where they're more neglected or more orphaned from health care. One of my favorite things, the things that I feel like I bring and I like to bring as a med-peds doctor, is that I'm more than used to working with parents. And adult doctors, internists, are not as used to working with parents. The parents are just sort of there, and they are more used to talking to the parent, and there may be even some ethical things where they feel like they shouldn't talk to the parent. There's a whole series of laws about that. And as far as I'm concerned, I work for the family, I work for the child, I work for the growing adult, and I work for the parent. And it's part of the parameters that I discuss with everybody as far as what can I do, what's confidential, what's not, what does the patient want to know, what does the patient want the parent to not know, that sort of thing. And so to me, transitions isn't really an artificial thing that happens at 18. 18 or 21 is just this barrier or this line that we say for a natural process as our children are growing up. And this may seem a little corny, but to me, transition it's kind of like a victory.